Booster shots, do we need them or not? The U.S. has already made clear its position. Boosters already encouraged for those with compromised immune systems.
It's a true statement that we believe sooner or later you will need a booster for durability of protection.
They've administered nearly 1 million boosters to date, and they want to make them available to all Americans starting September 20th. Israel is doing much the same, offering most citizens a booster starting 5 months after their second dose. So, with the highly transmissible Delta variant threatening a dangerous fourth wave here in Canada, what should we expect about whether boosters are in our near future? Well, here to answer that question, infectious diseases specialist, Dr. Zain Chagla. Hello, doctor. So the question, are they necessary or not?
Yeah, I think they're coming in our future at some point. And you want to look to places like the United States and Israel in terms of what's the same about their vaccine campaign and what's different. Well, we largely did use mRNA vaccines, so that really does say, there is a waning effect. And we've seen that even in the long-term data from Pfizer and Moderna. But you also see that effect really in people that got the dose on time, so that 3 to 4 weeks after their first dose. And largely the people that were vaccinated first. So Israel showed that people that were vaccinated in January and February had a little bit higher risk of breakthrough infections as compared to people who were vaccinated more recently.
Right, but let me jump in though, because when you talk about waning immunity, how urgent is that problem? Like, how much is protection actually waning over the course of several months?
Yeah, and this is where it gets really murky, right? We are seeing breakthrough infections amongst individuals that have gone to that January, February mark from vaccines. But we haven't necessarily seen a significant rise in severe disease, people who require hospitalization, people who need the ICU, and people who die from COVID-19 who have gotten vaccinated in that January, February piece. And so this is where the fields are a bit murky. The United States' suggestion is, well, there may be a waning of that initial immunity, the one that protects you from just getting infected. It's only a matter of time before you have loss of protection against that severe immunity. But a lot of immunologists and infectious disease physicians will say, it's not clear yet when that part is going to wane and really what the solution is. Do we vaccinate now? Do we vaccinate in a few months? Do we wait for a newer vaccine series to come out? Or again, do you just give it to vulnerable individuals who are at higher risk and let the general population wait a little bit more until you get better data?
But if we primarily have safety in mind, I guess my question is, why wouldn't we follow the example of a place like the United States or Israel and kind of err on the side of caution, right? It wouldn't the prudent thing be to get boosters into as many arms as possible so you avoid any problems down the road?
Yeah, and I think, again, prioritizing groups like those who are elderly, who have the most risk of having a dysfunctional immune response, those who have major immunocompromising conditions, similarly, who have the highest risk of having a blunted immune response, it makes sense. And we are starting to roll this across Canada. That general population piece, though, the investment of millions and millions of vaccines in Canada, United States, and Europe into groups where we're not sure if they're even at significant risk of severe disease after a full vaccine series, even being low risk to begin with if they're younger, it starts bringing up questions, especially when we haven't vaccinated a significant amount of the world. And again, there is a vaccine shortage for many countries where this is going to be felt even more when richer countries take millions of doses back to vaccinate their population.
Okay, so then here's the crystal ball question to finish off. When should the Canadian general public expect to have boosters recommended to them? And for that matter, how often would they have boosters recommended to them?
Yeah, so I think somewhere at about the year mark, most people may be offered their third vaccine. And the question is, again, what vaccine? Pfizer and Moderna are developing variant-specific boosters, and perhaps that may be the solution for us as compared to revaccinating ourselves with the same vaccine. The timeline, is really dependent, and the long-term response is really dependent on what happens. We're obviously in a new world here, but I think we will likely see more and more data come out from places like Israel, from places like the United States, to really say what this means from a logistical standpoint, from a sensitivity standpoint, and again, how to really balance this on the cost benefit of the world and when to do this appropriately.
All right, Dr. Chagla, very interesting chat. Thank you so much for your time.
No problem.